This is the HIV epidemic in Jamaica. It's a story of both a struggle and a success. The number of people newly infected with HIV has dropped by 25% in the last 10 years. Since 2004, there has been a 43% decline in AIDS-related deaths. Just 1 decade ago, 1 in 4 pregnant women living with the virus passed it on to their baby. Now, the rate of transmission is less than 1 in 20. And this is the country's HIV response. It includes programs for prevention, life-saving treatment, research, human rights advocacy, social protection and care. The government of Jamaica now accounts for almost half of annual spending. The rest of the HIV program investments come from international partners. However, despite committed work, gaps exist. Since antiretroviral drugs became available, thousands of lives have been saved. Yet 44% of those who need treatment still don't get it. That's partly because HIV stigma and discrimination are so strong that people either avoid being tested or going to HIV clinics for treatment. Poverty is another stumbling block. Some people don't even have the money to travel to their clinics. 1.7% of the adult population in Jamaica is living with HIV. However, higher rates are found among groups such as commercial sex workers, homeless people, and men who have sex with men, or MSM. The situation of MSM is especially urgent. According to a 2012 study, they account for almost 1/3 of new HIV infections. Yet a national AIDS spending assessment done in 2012 found that only 1.5% of prevention money was targeted towards them for 2009 to 2011. The Jamaican economy owes more than it earns. The country has a debt to GDP ratio of 140%, so there's not much money available for social services, development, and health. At the same time, foreign partners will dramatically reduce support for the country's HIV response over the next few years. The World Bank projects that the annual cost of Jamaica's HIV program could double by 2030. This pattern could lead to a massive shortfall that will make the program unsustainable. The instinctive response might be, if you have less, why not do less? So suppose we considered for a moment that the most critical goal was keeping people alive. It's a steeply rising expense because new patients will start treatment, and treatment is for life. But if the rate of new infections increases because of inadequate investments in prevention, this would eventually add to the future budget requirement for life-saving drugs as well. And if people already living with HIV don't feel safe and supported, the investments already made in their health can be lost. On the other hand, compromising access to treatment could mean that many people don't get the medicines they need. That would lead to a rise in AIDS-related deaths, infectiousness, and drug resistance. Neglecting any element of the HIV response erodes the gains of the last 3 decades, while making the current gaps wider and eventually far more expensive, both in social and financial terms. That's a snapshot of Jamaica's HIV dilemma. Every country has one of its own. The features of the epidemics might be different, and the programmatic spending and funding pictures might change. But the truth is that most Caribbean countries are facing a similar crisis as international partners reduce support. Even those countries that haven't relied heavily on partner funding must ensure that they have the right mix of programs and investments today so that their HIV epidemics are manageable in the future. The UNAIDS investment framework sets out 4 broad steps for building a sustainable HIV and AIDS response. Understand the problem. What are the treatment and prevention needs in your country? Design the investment portfolio to solve the problem. Is your package of services optimized to your needs? Deliver. Apply the investment portfolio at scale and generate efficiency. And sustain for impact and ending HIV and AIDS. That means figuring out today what resources are needed and available in the long term. Jamaica has done a good job at step 1 and has made progress on the other steps. It's critical that the country makes every aspect of its HIV program as streamlined and targeted as possible. Already, some possible measures have been identified. 1. Reduce the unit costs of antiretroviral drugs through negotiating regional bulk purchases and developing better inventory management to avoid placing expensive emergency orders or having drugs expire. 2. Reduce the inefficiencies of treatment facilities. Merging HIV with family planning programs, primary health care and non-communicable disease programs, and strengthening national laboratory services to do HIV diagnostics could also lead to savings and increased efficiency. And 3. Investing in the population groups that are more vulnerable to the epidemic. But even if Jamaica's government did all it could, that wouldn't be enough. The sustained cooperation of international partners, a flourishing civil society, and an enabling human rights environment are needed if the country is to get maximum value for each dollar spent on HIV. And what does this shared investment buy? A shot at ending AIDS.